Hi, good afternoon. My name is Amanda Whitson, and I am the nurse practitioner here at aNu. And I'm going to give a little presentation about IV therapy and the benefits this afternoon. If you have questions at the end of this, I will open it up and you guys can type in any questions you have. Otherwise, we'll go ahead and get started here. Okay, so we all want to do the right thing for our health. We eat right, we exercise regularly, we take vitamins, supplements, drink 64 ounces of water a day. But if you're like a lot of Americans, you might still be struggling to get out of bed every day. You might not feel like your mental acuity is very good. But the real truth is, no matter how hard we try, a lot of us are not likely getting all the vitamins and basic nutrients that we need. So you combine that with chronic stress, environmental pollution, and nutrient depleted foods, and it's no surprise that many people are suffering from chronic illnesses. But intravenous IV vitamin therapy may be just what you need to revitalize your body at the cellular level. So from enhancing your memory to boosting your immune system, there seems to be little that intravenous vitamin therapy can't do. Despite all the popularity it has gained in recent years, you may have been wondering, is IV vitamin therapy right for you, and what benefits can you see from it? So we're going to cover all of these questions and more. Okay, so IV nutrition. IV is an abbreviation for intravenous. To administer an IV drip, a small plastic tube called a catheter is inserted into a vein using a needle. The needle is quickly removed once the plastic catheter is advanced into the vein. And IV drips consist of anywhere between 100 to 1,000 milliliters of fluid with a mixture of vitamins, minerals, amino acids, and antioxidants. The intravenous route is the fastest way to deliver fluids and vitamins throughout the body with 100% absorption into the bloodstream. And IV drips usually take anywhere from 30 to 90 minutes to infuse. So, as we mentioned earlier, everyone, no matter your health status, can benefit from IV nutrition. Your body's cells depend upon nutrients to fuel their energy-producing biochemistry. Many factors contribute to the nutrients not reaching your cells properly, and IV nutrition is the fastest way available to replenish chronically depleted nutrient reserves. IV vitamin therapy works by the administration of vitamins and nutrients directly into the bloodstream. It bypasses the digestive system, so it avoids that first pass effect. This provides increased cell absorption and 100% bioavailability of vitamins via IV infusion. So when you take a supplement by mouth, it depends on the status of your gut health as to how much of that you're actually absorbing. So when you give something via IV, you get 100% of that absorption. With oral supplements, as I mentioned, you only get about 20% after filtering it through your digestive system, and that clearly pales in comparison to IV therapy. Keep skipping slides there. So after an IV infusion, the vitamins remain in your system and maintain your levels for approximately 2 to 3 weeks. So for preventative health and wellness, we recommend 2 IV drips per month to help balance any vitamin deficiencies. People who suffer from advanced stages of autoimmune diseases, have a history of bowel surgeries or other ailments, they may need continued IV therapy for nutritional support. And really the frequency of IV therapy is determined on an individual's goals and needs. Some patients will get progressively better, and after a series of treatments, they will no longer require ongoing weekly IV therapy, only monthly treatments to maintain balance. Other patients will need regular IV nutritional therapy in order to help alleviate symptoms of their chronic or common medical conditions. There are diagnostic tests available to better determine how often a person should be receiving nutrients. There's some functional lab tests that can literally tell you what you need. There's an ion profile that we've used, and it evaluates 40 amino acids. and can help identify nutrient deficiencies that way. There's also a Nutrival, and that's a personalized test that can determine supplementation needs for antioxidants, B vitamins, minerals, fatty acids, aminos, and select other nutrients. The electrolytes. So electrolytes are vital for the normal functioning of the human body. They regulate nerve and muscle function, they hydrate the body, they balance blood acidity and pressure, and help rebuild damaged tissue. The muscles and neurons are sometimes referred to as the electric tissues of the body. They rely on the movement of electrolytes through the fluid inside, outside, or between cells. And the electrolytes in the human body include sodium, potassium, calcium, bicarbonate, magnesium, chloride, and phosphate. So again, why are electrolytes so important? Muscles need calcium, sodium, and potassium in order to contract properly. Imbalanced electrolytes can lead to muscle weakness and excessive muscle contraction. The heart, muscle, and nerve cells use electrolytes to carry impulses to other cells. Both sodium and potassium are lost during exercise by sweating, and the rapid loss of fluids such as diarrhea or vomiting can cause decreased concentrations. Electrolytes must be replaced and balanced to maintain the body's homeostasis. Sodium. So what's in the bag? Most, or I should say all of our IVs, the base of the solution is normal saline or sodium chloride. So normal saline is an isotonic crystalloid, and isotonic means that the solution has the same salt concentration as your blood, tears, and other bodily fluid. The solution also has the same osmotic pressure, thus preventing osmosis. And because osmosis does not occur, it's given freely in emergency rooms and hospitals to expand circulating volume and for its hydrating effects. So we mix most of our IV cocktails or infusions in normal saline for that reason, extra hydration. Potassium. So potassium is an extremely important electrolyte that blunts the effects of sodium, helping to maintain consistent blood pressure. Potassium is also important for maintaining the balance of acids and bases in the body. It's necessary for muscle contraction. It maintains an alkaline environment in the body, keeps the heart beating, helps to ship nutrients into the cells, and remove cellular waste. Potassium also assists in the maintenance of healthy bones, and it can become seriously depleted during prolonged periods of vomiting or diarrhea. Calcium. We obviously know calcium is very important for bone health. It also helps regulate blood pressure, protects heart muscles, keeps the cardiac muscles contracted and helps them relax properly. It also helps with the nervous system and to maintain the proper pressure in your arteries, hence the blood pressure. And if there is a calcium drop, a hormone called calcitrol is released and contracts the smooth muscles of the arteries, thereby increasing your blood pressure. Bicarbonate. Bicarbonate is an ion and acts as a buffer to maintain normal levels of acidity or pH in your blood and other fluids in the body. And bicarb levels are measured to monitor the acidity of the blood and bodily fluids. Magnesium. Magnesium plays a role in over 300 enzymatic reactions within the body, including the metabolism of food, the synthesis of fatty acids and proteins, the transmission of nerve impulses. It's also important for bone health as well as calcium absorption. It prepares your body for sleep, relaxes your muscles, helps to shut off your mind, calms nerves by regulating two of your brain's messengers called neurotransmitters, which tend to keep you awake. And those are GABA and glutamate. It fuels the heart, protects your heart's pump, prevents heart attacks, provides elasticity for heart and blood vessels, helps your digestive system digest food, and reduces the rate that bones degrade. Trace elements. So trace elements are required in very small amounts. They include iron, iodine, fluoride, copper, zinc, chromium, selenium, manganese, and molybdenum. They're vital for maintaining health. They're also referred to as microminerals, and they are part of enzymes, hormones, and cells in the body. Insufficient intake of trace minerals can cause symptoms of nutritional deficiency. For people with normal GI functioning, the needs for these trace elements are easily met by eating a variety of foods from the different food groups. Zinc. So zinc is a trace element and is responsible for a number of functions in the human body. It helps stimulate the activity of at least 100 different enzymes. It's vital for a healthy immune system. It helps to correctly synthesize DNA. It's necessary for wound healing. Deficiencies have been linked to increased inflammation and chronic diseases and triggering new inflammatory processes. It's been popular in certain immune protocols with COVID. Selenium. Selenium is an essential trace mineral, and it's important for many bodily processes, including cognitive function, a healthy immune system, fertility in both men and women. It contributes to thyroid hormone metabolism, DNA synthesis, and can protect against oxidative damage and infection. The amino acids. So there's actually 3 different types of aminos: essential, non-essential, and conditional essential. Essential aminos cannot be made by the body, and they must come from food sources, and there's 8 of them. Non-essential amino acids are amino acids made by the body from essential amino acids or the normal breakdown of proteins. There are 12 non-essential amino acids, and I won't read them all off. You can see them there. Conditionally essential amino acids. So there's 6 other amino acids, and they're considered conditionally essential in the human diet, meaning their synthesis can be limited under special pathophysiological conditions such as prematurity in the infant or individuals in severe catabolic distress. And these 6 are taurine, arginine, cysteine, glycine, glutamine, proline, and tyrosine. Taurine. Taurine is a common amino that we do put in quite a few of our various IV cocktails, and it occurs naturally in the body, particularly concentrated in the brain, eyes, heart, and muscles, and plays an important role in many functions of the body. So it helps maintain proper hydration and electrolyte balance in the cells, contributes to the formation of bile salts, which play an important role in digestion, regulates minerals such as calcium within the cells, supports the general function of the central nervous system and eyes, regulates the immune system and antioxidant function, and plays several important roles in the muscles and may aid various aspects of exercise performance by reducing fatigue, increasing fat burning during exercise, decreasing muscle damage, and it protects liver cells against free radical and toxin damage. L-ARGININE, another common amino that we do add to several of our IV recipes, and it plays a role in building protein. And the body obviously uses protein to help build muscle and rebuild tissue. And the following are some examples of research benefits and uses of L-ARGININE. And those are growth hormone reserve, reducing high blood pressure by turning into nitric oxide, helps treat heart disease, helps treat erectile dysfunction, and can help control blood sugar in people with diabetes. Okay, vitamin C. Vitamin C, also known as ascorbic acid, is a water-soluble vitamin. It is the most powerful vitamin available for consumption. It is not stored by the body, and therefore regular consumption is recommended. Vitamin C acts as an antioxidant and is necessary for the immune system. It helps fight off free radical stress. It also produces collagen, a protein which is needed to develop and maintain healthy skin, teeth, bones, gums, cartilage, joint linings, and etc. and it's necessary for metabolic functioning and to keep the regenerative process going. More benefits. So obviously vitamin C is known as an immune booster. When your grandma or mom used to tell you to drink your orange juice, it was really the vitamin C that she was after, wanting you to get in. It's the holy grail vitamin for a strong immune system. It's an anti-aging drug. It's an antioxidant. Helps keep the body younger internally and externally, delays the appearance of signs of aging, and it boosts collagen production. Can help reduce high blood pressure. It helps relax the arteries under stress and facilitates the flow of blood. Can also be used in cancer prevention. So antioxidants are the answer to prevention of diseases such as cancer because it helps boost the immune system. It can help target cancer-causing free radicals that are responsible for cell DNA damage. So vitamin C and viruses. So with the recent outbreak of COVID-19, it's required us to find urgent treatments for numerous patients. While there is no current cure for COVID-19, the use of IV vitamin C has shown a lot of promise and is currently involved in 2 clinical trials using high-dose vitamin C in China and Italy. So vitamin C, as mentioned earlier, is also known as ascorbic acid, and it has antioxidant properties. So when sepsis happens, the cytokine surge caused by sepsis is activated, and the neutrophils in the lungs accumulate and destroy alveolar capillaries. So the early clinical studies have shown that vitamin C can effectively prevent this process. It can prevent the formation of the neutrophil extracellular traps, which is a biological event of vascular injury. And in another controlled but non-randomized trial, 85% of the 252 students treated experienced a reduction in symptoms in the high-dose vitamin C group. And then below are just the references to the 2 current clinical trials. B vitamins. So B complex vitamins help your body make energy from the food you eat. They help form red blood cells and play an essential role in certain bodily functions. There's B1, which is also known as thiamine. It helps the body use carbohydrates from food to produce energy. It's needed for the health of the brain, muscles, and nervous system. Critical for the growth, development, and function of cells in the body. There's B2, also known as riboflavin. It works with other B vitamins and helps convert B6 into a usable form and aids in niacin production. Helps convert food into energy needed for red blood cell production and growth. Keeps eyes, nervous system, and skin healthy. B3, also known as niacin, aids in the conversion of food into energy. Helps enzymes in the body function properly by helping the body use other B vitamins and makes and repairs DNA. It's needed for the production of hormones such as sex and stress hormones. It helps with the function of the digestive and nervous systems and skin. And B5 breaks down fats and carbs for energy. It plays a role in the production of sex and stress hormones as well. And it helps the body use other vitamins such as riboflavin. And B5 is also needed for the production of red blood cells and cholesterol. B6, needed by the body to use and store protein and carbohydrates from food. Required for more than 100 enzyme reactions in the body. Aids in the formation of hemoglobin, which is what carries oxygen in the blood. Also needed for neurotransmitters and hormones, which influence mood and regulate the body's clock. Involved in brain development and immune brain functioning. Vitamin B12. Vitamin B12 is known as the vitamin of energy and helps prevent fatigue. It also supports the regeneration of new and healthy cells in the body, aids in fat and carbohydrate metabolism. It's been shown to suppress appetite when it stimulates the utilization of proteins, fats, and carbs in the body, helps prevent memory loss, and lowers the risks of neurodegenerative diseases because of its role in the nerve health. maintains heart health by reducing elevated homocysteine levels, which is a major risk for cardiovascular disease. Glutathione. So glutathione is known as the mother of all antioxidants. It is a naturally occurring peptide produced by every cell in the human body, including immune cells, and it's made up of 3 essential amino acids: cysteine, glutamate, and glycine. It improves immune function and helps fight and prevent disease. It helps lighten and brighten skin by erasing hyperpigmentation, and it inhibits melanin production, reduces inflammation, helps your body break down and purge fat, promotes high energy and mental clarity, has anti-aging properties, and is the ultimate detoxifier and fights oxidative stress. Okay, so IV therapy options that we offer. These are our names of our IVs, and really it's all about the ingredients and the combination of ingredients in each of these. One of our most popular ones from this list is the Myers cocktail. And the Myers cocktail has been around for a long time. A doctor sort of invented it and used various combinations of vitamin C, B vitamins, magnesium, and calcium gluconate, and that's given in normal saline. So it's kind of a nice quick burst. It usually takes anywhere from 30 to 45 minutes to run in. The other popular one that that patients tend to really like is the Jet Setter. And the Jet Setter is has more fluids, and it's in a 500 milliliter bag. And it has, again, concoction of aminos, vitamin C, B vitamins. So really a lot of these IVs have similar bases and similar ingredients. It just depends on the amounts of ingredients as to what you're looking to get out of them. Okay, so advanced IV therapy. So advanced IV therapy, we do require that patients have labs on file for these. These tend to have higher doses, or they do have higher doses of certain ingredients, especially vitamin C. So we like to look at kidney functioning, liver functioning, and obviously make sure that someone's underlying health is up to par so that they can get one of these. Our most popular one of these is the Executive Brain Booster. And why? It kind of has everything you'd want in it. It's got all the B vitamins. It's got vitamin C at a pretty high dose. It has glutathione, so it's packed with antioxidants and B vitamins as well as aminos. So we also are currently offering some new immune boosting IV options. One is the Defense IV and the other is the Defense Supreme IV. These both contain vitamin C. We've used vitamin C at certain levels. In fact, some of the levels that are being used in the clinical trials I mentioned earlier. The difference is really the dose. So the Defense Supreme contains a higher dose of vitamin C. It has some other ingredients as well, but the primary standout is the vitamin C in those. So if you're somebody that is not keen on needles or doesn't have a lot of time to sit and let a drip run, we also offer a lot of intramuscular or IM shots or boosts at the practice. Our number one is our turbo shot, and that's because it's kind of a one-hit wonder. It contains all of your B vitamins plus something that's known as lipotropics. So they actually help with fat metabolism. So it aids in weight loss. It has some of the minerals mentioned, such as chromium in it, which help with blood sugar as well as weight loss. Another important boost on here is glutathione. So glutathione can also be given in an injection that's safe to get weekly, every other week, monthly, whatever you want. And it does help kind of promote detox. We also have Triimmune, and that's a newer injection, and that contains kind of a nice little combination of the B vitamins, vitamin C, as well as glutathione in one shot. And as with anything, there are potential risks. So the potential risks of IV therapy include headache, lightheadedness, and or nausea, what's called infiltration, which is the inadvertent administration of a medication or solution that gets into the surrounding tissue, phlebitis, which is irritation of a vein wall, infection, and allergic reaction. We do ask that patients come hydrated and with something on their stomach when they come in for any of the IVs, and that helps to offset a majority of these issues. Okay, and then ready to drip. So all of our IVs are prepared and administered by licensed registered nurses and nurse practitioners under the order of Dr. Watkins. Providers are happy to discuss your current symptoms and health conditions to assist you in determining what IV is best. We have a lot of options and a lot of, fun names for IVs, but sometimes patients are more confused because they don't know exactly what's in them or what they need. So we're always happy to kind of talk through that. And then in order to receive an IV through aNu, we do ask you to fill out a brief medical history as well as consent form. And all of the IVs are administered at the discretion of the providers and will be determined based on your health history and your current health status at the time of the IV. And as I mentioned earlier, the megadose IVs do require recent labs on file, and we will review that lab work with you. And as I mentioned earlier as well, it's best to come hydrated and after eating a small meal if possible. Okay, any questions? So I will open it up to questions. If anyone has questions, they can just type it in and I will do my best to answer those. We'll give you a few minutes here. Okay, oh, here we go. Okay, so I have kind of a more personal question here. Someone asked, if you've been diagnosed with fatty liver, do you feel this would be beneficial? So again, I don't want to give medical advice without reviewing everything, but short answer, yes. Anyone with fatty liver is a good candidate primarily for glutathione, but as we also know, the other vitamins and minerals help with fat metabolism and help with liver detox. So it kind of depends on the severity. So short answer, yes, but that would definitely be something that you'd want to discuss if you came in. Good question. And I appreciate everybody listening. I know it's Friday afternoon. It's probably been a long week for all of us, so. Okay. We'll leave it open for another minute here if we have any other questions. Otherwise, we will wrap it up. We are opening on Monday. We are opening using the, another question. So will the office be open or is it just limited customers at one time? We ask by appointment only, but yes, we are going to be opening up, but we're going to be following the Kansas City, Missouri Propers guidelines and the 10-10-10 rules. So things will look a little bit differently, but short answer, yes, we will be open. Our North location will be open Monday, and then our River Market location will be open Tuesday. right, guys, thank you so much for listening. I hope you learned something out of this. And if you have questions, you can always call the office and they can give you an email, or you can set up an appointment or a consult for IV therapy. But thank you again, and everybody have a great weekend, and happy Mother's Day if you guys are mothers. Thank you.